One of the most frequently asked questions that we get is, what is periodontal disease? And if we have crowns or fillings or work done to the teeth, can we still get it? The thing that you need to realize is, while tooth decay has been something that in dentistry has been focused on forever, we're actually probably most worried about gum disease from the standpoint this is the thing that is most likely to take your teeth from you. And so absolutely, fillings, crowns, anything that we do to your teeth from the standpoint of restoring them will not eradicate gum disease. Gum disease is something that affects the tissues and the bone around your teeth, and it's something that we need to be looking at every time that you come in, and is the primary reason that you have continual care with the dental practice and getting your teeth cleaned and being constantly evaluated. So one of the things that you also need to know is that gum disease, unlike tooth decay and abscesses and things like that, many times is completely painless. So the only way that we can determine the health of your gums is by doing a thorough evaluation, which is something we will do in our practice when you come and see us the first time. We do a complete exam, and it's also something that we'll do every time you come back with us and see our hygienist. So what I want to do is just take a minute and look at the computer and show you some animations so we can get really clear on exactly what this process is and what it is we can do about it. What we're looking at here is a patient education software package called Guru that we use in our practice, and it does a wonderful job showing an animation of what periodontal disease is. And so if we look a little closer at the teeth and the soft tissues, we can take this now and make it translucent in a way that you can see. When we take the gums away, you actually have bone around the roots of your teeth, and there's a physical space between the root and the bone where thousands of little ligaments essentially attach that hold the tooth in place. What gum disease or periodontal disease is bacteria will get into this crevice between your tooth and your gum. They'll kind of set up shop, and as they stay there, if they're not cleaned away, tartar will build up, which is essentially hardened bacteria, and you'll start to lose the bone around your teeth. And again, this seems like something that could be painful, but if this is allowed to progress, it can continue in a way that could cause you to lose your teeth. And again, in the world, this is the #1 way people lose teeth today. Remember, this is a painless process. You don't always see the dark tartar like you see in this animation. Gums will often be red and inflamed, but what I'm telling you is that the intensity of the discomfort has nothing to do with the intensity of the disease. So if we look at how we measure this and how we check you, we use something called a little periodontal probe that has little bars on it that equates to a certain number. In a healthy situation, we should be able to put this little probe between your tooth and your gum and get a reading of about 1 to 2 millimeters. And we're going to measure 6 points around each tooth. This looks like it's uncomfortable, but it's really not. This is a painless exercise, and the way we equate this is it's very much like taking a blood pressure or getting your cholesterol checked. What we're looking at here in health is how deep that little crevice is between the gum and the side of the tooth. Again, as gum disease progresses and you start losing that bone and the pocket gets deeper, that probe is going to go further underneath, and we're going to get a much bigger number. This, for instance, would be a 6, which would be moderate periodontal disease. So we've had a chance to go ahead and look at the etiologies, the causes of periodontal disease, and again, I just want to clarify that one of the most important things to understand is that gum disease is one of the primary biological things that can cause you to lose your teeth. And whether you've had fillings or crowns or veneers or whatever been done to the tops of your teeth, remember that gum disease is a bacterial infection that exists around the roots of your teeth that breaks down the bone and the attachment. It's often painless, and it's something that we have to look at on a regular basis to make sure you're okay. This can happen to you at any time in your life, and You can have 20 or 30 or even 40 years of good gum health, and changes in your own biologic makeup can start getting you prone to this problem. So again, as a good dental exam, when you come in for hygiene, we will do the probing, it's standard, and give you your number to make sure that you're healthy. If you do have some of the early or moderate, even late stages of gum disease, there are things that can be done today to treat it. And in future fact-type questions, we'll address the treatment, the various treatment modalities for gum disease. Thanks for joining us.